turn my camera on for a brief moment, but I am currently in Indiana, and we are getting buried with snow and ice and all sorts of things. So I'm probably going to have to keep my camera off because my Wi-Fi is bad. But thank you so much for sticking around. Everybody doing okay? Signs of life out there? Everyone's good? Energy's up? That's excellent. So I am actually going to start us with a video, and then we will go from there. And we are going to jump into some policy, some demands, some exciting work that's happening both nationally and in New York State. So if someone can do the video, we will catch you back on the flip side of that.
Everybody
has a right
to live,
health care, everybody,
don't stop.
The Poor People's Campaign, a national call for moral revival, has come up with a series of demands. And I want you to say those demands after I say them.
I know that you are here for the same reasons we all are here, to put our elected officials on notice. We demand an immediate restoration of the Voting Rights Act. We demand an end to racist gerrymandering. We demand a reversal of state laws that prevent municipalities from raising minimum wage. We demand a just immigration system. We demand a timely citizenship process that guarantees everyone the right to vote.
We demand an end to military aggression and warmongering. We demand a stop to privatization of military budget and any increase in military spending. We demand a ban on assault rifles and a ban on the easy access of firearms. We demand an end to federal programs that send military equipment into local and state communities. We demand that the call to build a wall at the U.S.-Mexico border be ceased.
We demand a ban on fracking, mountaintop removal, coal mining, coal ash ponds, and offshore drilling. We demand a ban on all new pipelines, refineries, and coal, oil, and gas export terminals.
We demand an immediate implementation of federal and state living wage laws. We demand the right for all workers to form and join unions. We demand equal pay for equal work. We demand a guaranteed annual income. We demand fully funded anti-poverty programs that protects the welfare of us all. We demand decent housing. We demand free tuition. We demand free tuition. We demand equity in education. We demand an end to the resegregation of schools. We demand equitable funding for historically black colleges and universities. We demand relief from crushing household, student, and consumer debt. We demand the repeal of the 2017 federal tax law. And we demand that the wealthy and corporations pay their fair share. We believe that we can win. We believe that we can win. We believe that we can win. We believe that everybody has a right to live.
I want you to know that when hands that once picked cotton join hands of Latinos, join hands of progressive whites, join faith hands and labor hands and Asian hands and Native American hands and poor hands and wealthy hands with a conscience and gay hands and straight hands and trans hands and Christian hands and Jewish hands and Muslim hands and Hindu hands and Buddhist hands. When we all get together, we are an instrument of redemption. When we join hands, we can revive and make sure that the promise of life, liberty, and the pursuit of happiness and equal protection under the law is never taken away from anybody. So I got a question. Are the rejected ready to revive and declare that this land is your land, this land is my land, this land is our land, and together from the State House to the White House, the rejected are going to demand that this nation never give up on being one nation under God, indivisible, with liberty and justice for all.
Whew. So I can't tell you how many times I have seen that video. And every time I do, my heart races and I get tears in my eyes. And this is a video that was made in 2018. And I was thinking about this video, even though I knew I was already going to show it. I was thinking about it this morning. For those of you who have been with us all day, you know, there has been this thread through our program today. This thread of boldness, this thread of imagination, this thread of what is possible when we believe it into existence. You know, Pastor Wilk said this morning, talked about the sacred fire of impassioned curiosity. What if we moved? What if we acted with that? Reverend Liz said so many things. But, you know, to end poverty with our hands, we must first end it in our minds. We must first end it in our hearts. I think that the Poor People's Campaign really demands boldness in us. And I'm just going to speak honestly that when I first joined the campaign, I was a little tripped out by that part. I'm going to be honest. I'm a realist. I'm pragmatic. I'm from the Midwest. I'm very much about achieving goals, setting like achievable goals and trying to reach them. And I was daunted by these set of demands. And yet, you know, it's because this is what's been ingrained in us. We've been ingrained that there is limited possibility, that there are limited resources, that we have been taught this myth of scarcity when we know we live in a land of abundance. We live in the richest nation in the world, which finds the money, which finds the power, which finds the will when we're bailing out Wall Street, or when we're funding our military. But we quibble over crumbs when we're talking about helping people in need. We tell ourselves we can't have affordable health care. We can't provide housing to everyone because, you know, that's just not possible. That's just not possible. We can make incremental steps. But we know it is possible. And we know that's what we have to demand. And so I, for one, am grateful to the Poor People's Campaign and for being here for this many years and for being taught to think boldly and to imagine what can be done. And so we're going to shift a little bit to policy and to what these demands are and to how they play out. And this is going to be a quick little overview. There is so much we could dive into. But as a national organizer and both as someone who works nationally, but also works very closely with our state campaign and has worked with our state campaign for the last couple of years, I want to just quickly talk a little bit about the national perspective and how that kind of plays into our local strategy, and then turn this over to some beautiful colleagues of mine who will talk about that local strategy. So we're going to work together on this because my Wi-Fi is so bad. And we're going to talk about the 14 policy priorities. That is sort of the most recent set of demands that the campaign has put out. And these are specific sort of legislatively and bold. And these are for the first 100 days of this new administration. So this isn't like someday, somewhere, somehow over the rainbow. This is like, no, this is what we're demanding now. And I'm going to, we're going to walk through where you can find these on your own as well. And also we'll send all, resources out after this. But Pauline is going to take us to the Poor People's Campaign website. And so if you go to resources, once you come into if you go to about, and then if you drop down, you can find the 14 policy priorities to heal the nation. A moral and economic agenda for the first 100 days. So we are not going to go through all of these in the interest of time, but I encourage you to take a look at these. These are spelled out. And these really frame everything from, from healthcare to housing to voting rights, just really, really powerful demands. And we're going to look at a couple of them right now. And then we're going to talk about how this is kind of being implemented right now. So one thing, and I'm afraid I'm going to forget to mention it, so I'm going to mention it now, is that on Mondays, the national campaign is doing Moral Mondays. And so there is actually one starting in about 7 minutes that a state I've heavily worked with is being focused on. And we are calling out these demands and these priorities over a series of Mondays: raising the minimum wage, fighting for the right to form a union, free tuition, enacting comprehensive, free, and just COVID relief. And we're going to look at a couple of them a little bit more specifically, because the way our strategy and our organizing works is that the state campaigns sort of take a look at these national priorities, and we're going to fight for all of them. But in New York State, we've chosen to focus on a couple of them. So I'm going to focus on those two now as we sort of transition into state organizing. So we're going to look at number 2, which is guaranteeing quality health care for all, regardless of any pre-existing condition. So when you go to these policies, you can, just what Pauline just did there, you can click on it and drop it down. And then we'll just take a look at what some of these things mean. This means expanding Medicaid in every state, securing Medicare, enacting single-payer universal health care, and building up our public health infrastructure. Medicaid expansion will provide health care for poor and low-income people immediately. And there's widespread support for this. We know these things are what our people needs. We know that everyone will benefit from these. When we lift from the bottom, everyone rises. This is meant to improve the lives of not just all New Yorkers, but of all folks in our nation. And these are just the morally and just things that we are called to do. This is what our country should be providing, and this is what us as people of moral conviction should be fighting for. So we have some experts who will be coming on just a little bit to talk a little bit more about how that strategy is being implemented here in New York State. but I'm going to read just a few below it and then we'll hit the next one. So we are demanding that the minimum rent wage be raised to $15 an hour immediately. Current legislation is calling for it to be rolled out in by 2025. We are really demanding that that happens sooner. And what we know from research is that it really should be like $23 an hour. That again, these are basic needs. There is not a corporation alive that would put up with doing things as incremental and as, in such a pittance way as we do in how we treat the people of this country and to treat individuals, and especially poor and low wealth people. So we are calling for an update of the poverty measure, because the way we even count poverty and look at poverty in this country is completely dated, and does not take into account race and age and familial status and geography, and that we need data that really shows this, and we need data that accurately reflects the current conditions of poverty and economic insecurity. And besides these little definitions we're given here, these are also spelled out much more detail in the full policy platform. And then we're going to look at more closely the guaranteed quality housing for all, because again, this is something that New York State has really taken on. We know we have to stop foreclosures and evictions. We know that the eviction moratoriums that were put in place were not true eviction moratoriums, that they were for some, they required a tremendous amount of onus was put on the person rather than the landlord. We are asking for a stop to all foreclosures and evictions. We're a rent freeze. We're moving the burden of proof off of renters and households that are facing eviction to the financial interests that are seeking eviction. So again, it's this, shifting this power and shifting the burden that is put on people. And so we'll be looking at those a little bit more closely. I'm just going to kind of quickly go through the rest of these just to read them, but just to give you a taste so that you will go and dive into these. We want to enact a federal jobs program, protect and expand voting rights and civil rights, guaranteed safe, quality, equitable public education, with supports for protection against resegregation, because we know this is happening all over our country. Comprehensive and just immigration reform, ensure all the rights of Indigenous peoples, enact fair taxes, use the power of executive orders, redirect the bloated Pentagon budget towards these priorities of matters of national security, and working with. We're demanding that the new administration work with the Poor People's Campaign to establish a permanent presidential council to advocate for this bold agenda. So I purposefully have just touched on these, one, because we are in the interest of time, but because all of these require deeper dive in and deeper study. And again, one of the things that I appreciate so much about the Poor People's Campaign is we don't put out a list of pipe dreams and then have treat them like pipe dreams, have no idea how to enact them. We know these things are possible. We have a moral budget which shows how these things will be paid for. We've done audits, we've done the research, we've done the work. And there's a lot of information available on these websites. And it's just up to us to help reframe this narrative around these issues. And I think that people of faith and communities of faith are so uniquely positioned to help change this narrative, to help envision and make real the beloved community, to help people know that these things are possible. And so that is really, what we are calling on people to do. We're going to mention some things at the end of today. I really hope that you stay till the very end of today so we can tell you how you can get involved. There are policy calls on Thursday evenings that dive deeper into this, that help walk through people through this. We have these Moral Monday actions. New York State is going to be doing actions coming up. So there are lots of ways to plug into this. But I've just given you a little taste now, and I'm going to turn it over to my colleagues and my friends, Rebecca Gerard and Yuling Ko. And I don't know who's going first, so sorry about that.
That's okay. And actually, I'm gonna say a couple words before I hand it off to the
Oh,
two
sorry,
of
I didn't
you.
read my, yes, yep, sorry, West.
No worries, no worries. I'm Reverend Wes McNeil again. And as Kelly mentioned, in the New York State campaign a couple of years ago, we decided to focus especially on healthcare and housing, not to the exclusion of all the other things in our platform, but to focus in on these issues in our organizing and to look at how they can be seen as sort of a lens through which all of the other issues we talk about connect to healthcare and housing connects to each other. And just very briefly want to share a couple of reasons why we made that choice. One is because of the relationships that we were building through the organizing with leaders and movements in New York State, that it just made sense to really dive into these relationships that were already being established. But also because we see how fundamental these issues are to the experience of folks all across the country and across our state. And one of the goals of the Poor People's Campaign is to build power by building leadership and unity among leaders across lines of division. And these are issues, healthcare and housing, that impact people across any of the spectrums that you can imagine, across all these lines of division. And so there are opportunities to bring the poor and dispossessed together, to bring our class together. And also, these are challenges that we know, crises that we know are increasing now during the pandemic, and we can expect to see them increase going forward, that more and more people are facing a crisis in being able to access housing and a crisis in being able to access healthcare that's affordable and actually meets their needs. And this is also a weakness of the system that we are facing. Healthcare and housing are things that people only have a right to in this country if you have enough wealth, if you make enough money, if you have enough income. And more that contradiction is showing up as just an immense, inhumane moral outrage as more and more people don't have access to these very basics of life. And so when we raise that contradiction and we share the stories of how people are unjustly stolen, it puts the ruling class on their toes, on their heels, I should say. I saw toes in the chat. And it shows how the system isn't working. And so I'm going to turn this over now to two of our leaders in the New York State Poor People's Campaign, both on our coordinating committee and also leaders of struggles for housing and healthcare in the state. So we have with us Rebecca Gerard, who is the statewide organizer for Citizen Action of New York, and one of the key leaders in the Housing Justice for All campaign in New York State, and also Yuling Ko, who is the co-director of the Campaign for New York Health. And these are two movements that we've partnered with really closely, and they're going to share a little bit more about what the landscape is in New York State right now. And I'll turn it over to Rebecca first.
Thank you, West. I'm going to be really responsible with my time because I feel like I could talk about housing all day. So I'm looking, it's 3:04. I'm committed to stopping by 3:14. So thank you. Yeah, I can't think of a better way to spend this next hour. And wow, yeah, that video, just to echo Kelly, moves me every time I see it. Dr. Barber, Dr. Theo Harris, and all of us in the movement, right? How I miss being able to share space and take direct action. I want to name that. And I look forward to when we're able to do that again. So I want to kind of spend my 10 minutes talking about the housing crisis in two ways. One is the policy that's related to kind of our demands and how we can and are and should be showing up in reaction to that. And then the other is in thinking beyond that and outside of that, and in pushing the narrative even farther. So to start with bucket one, right? We knew before the pandemic in this state and in this country, we had a housing crisis that was unconscionable, immoral, unsustainable, where in this country you could work full-time twice over, right? And not be able to afford a market rate apartment. And in this state, 50% of tenants were rent burdened and a quarter were severely rent burdened, right? Where we had, by the most conservative estimates in this country, again, pre-pandemic, right? Over 500,000 people who were unhoused, and in the state, 100,000 who are unhoused. And again, we know those are gross underestimates that don't account for people who are sleeping in cars, right? Or sleeping in parks. These are numbers that are gleaned from shelter point in time data. And so just to give an example for New York, we know how gross of an underestimate that is because New York City schools tell us that we have 100,000 students who are homeless every year. So clearly, right? Telling us that we have 100,000 New Yorkers who are homeless in a year is an underestimate. And that was all pre-pandemic. And we knew the crisis we were in, right? And those statistics, right? Those two coexisting populations are linked and causal. You can't have an unaffordable, unsustainable housing market without seeing a population that's unhoused the way we do. And we've seen an increase in people who are unhoused and homeless. That's increased 40% since 2010. And that's directly related to the fact that the affordability crisis of housing is out of control, and it doesn't keep pace with wage increase, right? Housing costs far outpace wage increases. And so we have to deal with the crisis we're in, but we have to start to unravel the systems that are creating these crises. And so then the pandemic hit, and now a system that was already broken and unsustainable is now dire beyond anybody's, I think, right? Anybody's capacity to even fathom. Where in New York, we have between $2 and $3 billion owed in back rent, where we have people who are in shelters, which was immoral and utter failing on the part of our state government that's so wealthy, and is now a literal death sentence for people because they can't shelter safely and they can't socially distance. And so what are our immediate policy needs to address that? We need the state to forgive, right? And just wipe off the books the rent that is owed and only fund property owners who need that rent to maintain their properties, right? Whether it's through mortgages or property taxes. But not a dollar of state funds should go towards millionaire and billionaire property owners who can easily afford to take a hit in this moment. We've got to stop the patterns of our government in bailing out the wealthiest and those with the most resources. And this if there's not a clearer moment than this, I don't know what it is. I really don't. In terms of those who are unhoused and homeless, our immediate policy demand is that we use empty hotels, right, and housing to ensure that people can be safe in this moment and not die because of something so simple as the fact that they couldn't socially distance, right? Those are our immediate demands. But I want to like save my last 3 minutes for how do we stop putting ourselves in this position, right? How do we keep getting here? And that's about changing the narrative. And I want to go back to something Arelis said, right? This country is born on stolen land. And every step of this country is built on stolen labor, land, slavery, right? And our narrative is so centered on property ownership over humanity and safety and human rights, when property ownership is centered in the genocide that this country was built on and the slavery that built it. And that's from its onus, but also to, right, like FDR's New Deal that everybody still to this day holds up in history as this like beautiful solution that we should be emulating, when it was racist in its policy because it excluded any Black person, right, from accessing relief and housing security. That is one example of every example that this country has been built on. And so property ownership has always in this country, always been centered in a classism, racism, not equity. And so we need to push the narrative to say that housing is a human right. And the free market is never going to get us there. It's never going to get us there. Period, end of story. That's it. And so vouchers in this moment are an important short-term solution to triage this crisis. But what we need is our solutions that don't free the free market that created this crisis. We need to say that housing is guaranteed to everybody. And that looks like state funding not going towards investing in developers, but investing towards social housing, public housing, tenant cooperatives, residential cooperatives. And it can work. The narrative that we're fed all the time in this country is that those are failed systems. And the reality is they work all the time in other countries. There are failed systems in this country because we disinvest in them, because we set them up for failure, because we feed the free market intentionally, because we're capitalist and we don't want to ensure housing is a human right. We want to ensure that the wealthy stay wealthier and those who can't access housing stay in that situation of need, right? And so I really want to talk today, and I'm done now, but right during the question and answer, about what are the solutions that really upend the systems that keep bringing us back to this place. Because if we don't start to address that, we're always going to find ourselves here.
Absolutely. Thank you so much, Rebecca. And that's a really provocative note to leave us on. And we will be coming back to questions and discussions. So feel free to put questions or comments in the chat as we go. And now I'll turn it over to Yulin.
Hey, everybody. Is it possible for me to share my screen?
Yes, just a second. I think, Joe, you will need to do that. Great.
Should be all set.
Thanks. Okay. So, hey, my name is Yuling. Thanks for having me. I use she, they pronouns. I'm based in Brooklyn, New York City. And I am on the New York State Coordinating Committee for the Poor People's Campaign and recently the co-director of the Campaign for New York Health. So the Campaign for New York Health is a statewide coalition. We work to pass and implement legislation that guarantees universal health care for all New Yorkers in New York State. It's like Medicare for all. And we're a statewide coalition from North Country to Buffalo to Troy to Elmira to the Hudson Valley, the east end of Long Island. And we're really proud of building that movement over time. I mean, it took a lot of unsexy work and time to do that. We have nurses, and in fact, they're leading the way, especially NISNA and 1199, two of our largest healthcare unions in the state. We have physicians, med students, social workers, home care workers, other healthcare workers. And we have more than 500 businesses, worker cooperatives, freelancers statewide in support of guaranteed healthcare for all. We have faith leaders, many of you in this room already. Hundreds of political grassroots service and community organizations and unions statewide as well. So thousands of New Yorkers and also nationwide through the Medicare for All movement, wanting to see New York State make healthcare a human right all of these years. And now especially wanting to see New York State respond to COVID by making healthcare a right for everybody. And this was all over time, right? It didn't happen overnight. The campaign started in 2014. The first public hearings in 2015 were frankly white liberals reading statistics about how fiscally responsible the New York Health Act is and not much else. And it's important to be fiscally responsible, yes. But to say that we had historic public hearings in 2019, and not just in New York City, but all over the state. And they went on for 12 plus hours. They included dozens and dozens of testimony from those closest to the crisis and included how health is interlocking with food security, with housing, with disability rights, and more things. So we've grown into a more multiracial, multi-faith, multi-ability, multi-age, all of that. And that has been pivotal for moving the needle in the healthcare as a human right movement. We still have many more people to bring in and to activate, right, to engage deeper. Because even if this bill passes tomorrow, we have the long fight to make sure it's implemented equitably and for the people that we intended it to be for. And so that's one of the reasons why we really focus on, that we like to focus on our story-based advocacy work, political education of why healthcare and how it's interlocking with these other issues, such as housing, especially housing, in building this mass movement that like really is this long-term work of shifting the narrative. So we need that unity across differences in order for health justice and therefore racial and economic justice to be realized, to be sustainable. We don't want our healthcare or housing to be dependent upon the Democratic Party or any party, right? We want healthcare that is based on people's needs. And this is why this long-term slow movement building work is so imperative. Also to have the strength in the face of our opposition, which is quite formidable, the profiteers and our oppressors who will continually try to chip away or dismantle what we build with a lot of misinformation, trying to distract us with Band-Aid solutions that don't actually attack the root problems and doesn't care about the significance of what poverty does to people. These next slides are about myths and misinformation about single-payer healthcare, which is what our path to healthcare for all is, but I'll skip over those for now, just in the sake of time. And someone please interrupt me because I have lost track of how much time I'm taking. So just, you can straight up verbally interrupt me. I won't see the chat. But to say that, you know, we needed healthcare for all before COVID-19, right? No work now, no income, no insurance. Our public health programs are being even more burdened simultaneous to Governor Cuomo decimating public funding for our healthcare. And also the horrifying news recently about how Governor Cuomo has lied about our nursing homes, the deaths in nursing homes in New York, that I want to highlight here that the New York Health Act covers long-term care and support services from day one of implementation. And this is crucial, right, for protecting the health of seniors, people with disabilities, the people who give them care by providing home care and supporting the families and patients who need this kind of care. So for a caring economy and also to deinstitutionalize our community, right? And a note to say that the rich keep getting richer and in fact are making record profits during COVID, including health insurance companies who are making record profits by denying care during a pandemic. So kind of briefly, the New York Health Act removes the healthcare profiteers. It builds a truly universal guaranteed system. So it doesn't matter your immigration, your employment, your health, your income. It also includes anyone who works full-time in New York but lives elsewhere. It's comprehensive. So there is freedom and choice, meaning your eyes, ears, and teeth, mental and emotional health are part of your body instead of a supplement or a perk. And it's fairly funded. So the New York Health Act actually generates enormous savings by replacing the marketing bureaucracy and profits of insurance companies with a single publicly accountable plan, as well as negotiating fair prices with drug companies. And so we have data that shows at least 90% of New Yorkers would save money on healthcare in comparison to what they spend now. Let's see. So what I really want to get to is that the New York Health Act is more than just health policy, that racism works to fracture and scatter families and communities. This is a quote from Dr. Rhea Boyd. She is a pediatrician and public health advocate based in Oakland, California. And healthcare is one of our for-profit current system of healthcare is one major structure that upholds and enables this kind of white supremacy. So the New York Health Act helps dismantle and transform our healthcare structure to be more equitable, to be a caring economy. And that racism also is part of a public health crisis in all of these different arenas, including housing, very much so. And that is why we work in solidarity with many seemingly non-health related areas. And so decarceration is part of protecting public health. And this isn't just, conceptual. It's 2019, New York spent $18.2 billion on the carceral system, and yet only spent $6.2 billion on mental health, youth programs, and elder support services combined, right? And we're also in support, for example, of the Invest in Our New York campaign, because wealth redistribution is part of creating an equitable conditions. And Dr. Rhea Boyd also emphasizes that health inequities are made, and this is really important, that health inequities are when certain populations are made vulnerable, often through inequitable distribution of protections and supports. And this is what we're talking about, right? We want to dismantle the root problems and understand how they're interlocking with everything. There's so many social determinants of health, the trauma of not having housing, the trauma of functioning in a carceral state, of mental health crises being responded to with violence instead of care. There's pre-existing trauma, there's trauma being put upon us today, and we'll continue to have trauma as we work towards a reimagined society, past the Band-Aids and incremental things that are important, that move us towards a reimagined society. So for me, the New York Health Act really clicked as a racial and economic justice issue and something to prioritize, because it gives us the care we need as we move towards this reimagined society, removes this huge layer of racial and economic obstacles that have significant impact on our whole lives, and not just what happens in the hospital or doctor's office. And these are the conversations that help unite across differences, not only for people who are seemingly on the polar opposite side, but also, and almost more importantly for me, help us relate and resonate to move passive supporters to being active supporters. So I think maybe I'll stop there. Thanks.
Perfect. Thanks, Yuling. Both of you, Yuling and Rebecca, just put out so much content so succinctly, and there's so much here to dig into a little bit more. So we do have about 25 minutes to keep the conversation going. So please put thoughts in the chat or questions in the chat. The first one I'll lift up from Jonathan, really, I think, is the question that you ended with, Rebecca, and I will turn it back to both of you. A big picture question: how do we upend the systems that keep perpetuating our current system? The softball for you.
Yeah. I think I'll talk specifically, right? And it's going to make it seem really easy. And the reality is it's not, right? I think I can interweave it with some of the amazing points Healing made. The reality is that there is profit to be made off of the oppression and pain of our people. So you heard Yuling say that the New York Health Act is actually a cost saver, right? The reality is that we know there have been countless studies that show that providing every unhoused person with supportive housing and services, right? Mental health services costs 3 times as much, right? To not implement those proactive measures, right? It costs 3 times as much to deal with the backside of that, right? The policing of it, the emergency room visits, etc. But the shelter industrial complex is an enormously profitable one. It's an enormously profitable one. And so, right, we're taking on capitalism because solutions that are just and equitable and make sense and reduce harm, reduce profit. I mean, that's just reality. And so pharmaceutical companies and the real estate industry, right? And shelter nonprofit providers, right, will all go out of business. And that makes sense to all of us, but these are enormously, powerful lobbying interests. And so it's really naming that to me, right? It's really understanding and naming that not only is it the moral imperative, but naming the really fiduciary, right, motivation for these solutions. Often I think our opposition tries to sell these solutions as just. You know, people are going to lose out on healthcare, right, if we don't have private insurance. People are going to not have housing, right, if we don't have developers who are willing to build, you know, new developments, right, without these tax incentives. And it's just a lie, right? So I think we need to really name both like the moral imperative and the lie in that, the absolute lie in that, to really start to be able to move and shift the narrative, and be able to finally move policy and hearts and minds is going to drive policy.
To echo a lot of that, I mean, agree with all of that. So the same thing comes to mind when people talk about immigrants and those without status using up our healthcare and costing the system, when in fact if they had preventative care, if they had access to care in the beginning, then they wouldn't be suffering so much. And they also don't actually cost the system that much, like they pay into the system. So those kind of myths, yes. And absolutely, I want to emphasize that we have the same enemies in healthcare and housing, as Rebecca already mentioned. Especially, for example, real estate profiteers those are the people that are closing our hospitals in our rural areas, in like the poorest communities, in BIPOC communities, especially predominantly, right, in the most vulnerable communities. And that solutions to our public health crises can't be siloed. So this is one of the main reasons I like love the healthcare and housing fight together, because we can't be siloed. This is exactly right what our oppressors and rulers want. They want us to be pitted against each other, fighting for the same crumbs, and the same band-aids, really, right? If we work together and we can have more conversations about how interlocking these issues are and why we need to fight together, that makes us stronger and actually able to make changes. And something that Becca said in the chat reminded me that like none of this is actually radical, right? When people are like, whoa, we can't do that. Whether it's pie in the sky or they just don't have the imagination of how we do this, like we actually have really well thought out plans on how to do this, like Kelly and Rebecca were saying earlier. So it really just requires those one-on-one conversations, a lot of one-on-one conversations, to redirect people, to shift the narrative, to expose the lies, the false narratives, and the like half truths of like one example, the New York Health Act, people are like, oh, it's gonna raise your taxes. And we're like, well, it does have a new tax, but you actually save money if you look at the whole picture, things like that. Yeah, but breaking down the silos is something I really want to emphasize.
Yeah, absolutely. Thank you both. So a question from Bonnie that refers to one of the things you said, Yuling. What would be a next step from passive supporter to more active supporter? And maybe start with you, Yuling, and I'm sure there's answers for you as well, Rebecca.
Actually, Rebecca, do you feel like starting?
Sure. You know, there are really specific ways to support policy in both. And I want to plus one what Yuling said, where like we can get siloed, right? And I think like one of the things I admire most about Yuling is her deep commitment to intersectionality of our issues. And it's something that as issue area people, we can lose track of. And it's one of the things that I think our opposition would love us to do, right? And Yuling is like one of the people in the movement who really like always reminds us not to do that, and how our shared power is in that intersectional power. But so like, if you look at housing, right, we have programs like at the state level, like 421A, and it's upstate. It's Upstate Friend, which like spend billions and billions and billions of dollars of giving developers money from the state to build developments. And like data has shown us this does not bring, right, the cost of housing down, right? It doesn't give us affordable housing. You throw huge amounts of money at developers, and then they're obligated, semi-obligated to include a small portion of affordable housing. Take aside the fact that the implementation is abysmal, right? And we're not even sure we get that. The market rates just go up around it, and it just gentrifies the hell out of the area, right? I mean, so it doesn't work. What we could be investing in as a state are things like TOPA, which is Tenant Opportunity to Purchase Act, right? Which is the creation of social housing, right? So we could be investing in community land banks and land trusts. We could be investing in social housing for people who are unhoused. So we literally could be demanding specific policy initiatives, right? So that's like going from a passive, like non-specific, just to get to the question, right? Supporter to really supporting specific policy initiatives, and saying, and then to go to Yuling's point, right, to saying this, right, these are the group of things that will make New York work for every New Yorker. And it's the New York Health Act, it's TOPA, it's a significant investment in social housing and public housing. It's the end to giveaways like 421A. And if we're looking at the federal level, right, we spend billions at the federal level on programs like opportunity zones, which is just sort of the federal equivalent of like 421A, right? We should repeal the Fairclough Amendment, which prohibits the creation of any new public housing. When we know that's a program that works if it's invested in, right? But right now in the US, we are prohibited from creating any new public housing. So there really are specific policy initiatives that we could be supporting. And in my mind, if we could create a scope of those, that takes us from passive, like idea oriented advocacy to really specific, here's our path, right? And here's the map, and we demand it. Actionable advocacy.
I'll share maybe from like an organizing side, passive to active supporter. There's so much, it's actually a hard question. So thanks, Rebecca, for going first. There's so many simultaneous actions and different ways to engage, right? And each one of us engages differently and has different, what we're comfortable with and things like that. So I guess in terms of going from passive to support, and what I mean by passive is someone who they might get our emails and they might say they might come to the rally and hold a sign that says we support guaranteed healthcare and housing. But I'm hoping to move them from showing up, which is important, to understanding their own story, building leadership with them to understand their own healthcare and housing story, to speak it also then, whether it's at a speak out or in a letter to the editor or just with your neighbor, right? So being able to have those healthcare conversations, I think going passive to active supporter really just takes one person even to just want to have a conversation about their healthcare experiences, is the best start to root it in that story-based advocacy and work.
Absolutely. Thank you both. Yeah, and I think just to reflect back a little bit to the earlier conversations of the day as well, I think a lot of the challenges is being connected to, right? That we're not all going to be doing everything, and we'll have, to put it in faith language, we'll be called to different areas of the work and different roles in the work. But if we're not connected to one another, then we can't see how we fit in. And so, I think one of the things we're trying to think about today is what are the roles of people who are faith leaders and people within religious congregations or religious communities. And that itself can look a lot different. But if we're not connected to all these other pieces of the movement to each other, then we're kind of lost. So keep putting some questions in the chat. I'm gonna add one, and I think you were starting to get into this, Yuling, in your presentation. But if both of you could give a little summary of sort of where are these issues at right now in this legislative session, and kind of what do you see coming up?
Do you want to go first, Rebecca? Okay.
No, I want you to go first. I keep going first.
Okay.
I feel like I'm taking all the time.
No. Okay. So the New York Health Act has passed the Assembly 4 years in a row with a 2-to-1 margin. We are optimistic that it will pass the Assembly this year as well. In the Senate, we are still one senator away from majority support, though we are more optimistic this year to be able to reach number 32 to have a majority in the Senate. So then we'd have a majority in the entire legislature. And so right now, the bulk of our work is phone banking and text banking and reaching out to constituents in target legislative districts to have those constituents contact their legislators to be like, hey, co-sponsor the New York Health Act, and here's why. And so we're more optimistic, right? Because we have a Democratic supermajority, whatever. And there is also just more momentum, especially with COVID, right? Also. So we hope to reintroduce in the next 3 to 4 weeks. It happens that Medicare for All nationally may also drop at that same time, be reintroduced. And so we hope to drop it with a majority of the legislature on board, really helps the momentum in the narrative, right? Then at that point, we want to pressure the leadership, so Senator Andrea Stewart-Cousins and Assemblymember Carl Hastie, to bring it to a vote on the Senate floor. And then it will go to Governor Cuomo's desk, but we have a supermajority, so it almost doesn't matter what he does because we can override if he says no. But just a note to say that he's a champion of austerity, as many of us know. We expect him to cut Medicaid again, even though we're deeper into this pandemic. And in terms of the New York Health Act, he says he supports single payer at the federal level, which for most people who say that, it's just to hide. They just want to give an excuse for why they don't support the state level. That's kind of the political, like technical political landscape. I'll stop there.
So I'll try to keep this short, right? So for housing, I think the fact that we're still in a moment when we're dealing with the response to COVID legislation, it really hurts us and distracts from legislation that we would like to push that shifts the narrative. And that's really unfortunate. But that's real. So part of what's really hindering us is that we have federal money that has come in right now, $1.3 billion in December, and we anticipate more coming in. And that money has restrictions attached to it that make it impossible to use for the bill that we're supporting, which would say, forgive the rent for tenants, all tenants, and have landlords apply and fund them based on need, right? So the federal restrictions on the funds say that tenants have to prove impact to qualify for assistance. It says that they have to be 80% AMI or less to qualify. And so we're in this really unfortunate position of knowing that the state won't say, federal government, we're not going to send back your $1.3 billion and probably more coming in, right? We're trying to influence the restrictions on the next round. And so really the place we're in now is trying to make the way that 1.3 billion is used the best that it could be, and fighting to say you need to use state money to make sure that everybody who's not covered under the federal money that's coming in, right? Because we also, honestly, we don't think they should turn back 1.3 billion in federal funds, right? But they should use it in the best way possible and then raise revenue to the tune of $50 billion under the Invest in Our New York Act to make sure that part of that is used to cover everybody who's not covered under the federal funding because of the restrictions in the way that we want it used, which is to say every person's rent is forgiven and landlords are funded according to need. It's really unfortunate, right? Because even the best possible things we can do with the federal funding are going to fund landlords who don't deserve to be funded. And it's, stinks. I don't know what else to say. It stinks. It's bad. We want housing access voucher program funded. That has to happen with state money, which creates like a state level Section 8 voucher program to ensure that people who are unhoused actually become stably housed, and we're not in these Band-Aid. I know policy conclusion, it stinks. Sorry, that wasn't very eloquent, but it's these are, it's so galling to me that rich billionaire and millionaire developers are going to get a dime of government money. And yeah, here we are. So trying to do the best we can with the situation we're in. Really need post this budget, right? And post trying to figure all this out. Good cause eviction in the state, which starts to reverse, right, these harmful trends that we talk about. And a lead, we don't even have time to get into this, but a lead code bill that starts to address the lead crisis in the state. The state has the highest number of children poisoned by lead in the country. We have most upstate cities and counties who have children poisoned by lead at 5 to 10 times higher than the children of Flint, Michigan during the height of their crisis. And this has existed for decades. So we have a lot going on this legislative session.
Absolutely. And it's you know, a constant reminder that there were fights and a housing crisis before the pandemic and a healthcare crisis before the pandemic. And we see this, you know, both opportunity to open up the conversation as the crises are exposed, but also, as you're talking about, Rebecca, there's, you know, this block now of people having our legislators having a very limited vision of what a response looks like. Reverend Olivia, I see you have your hand up. Did you want to ask a question?
Can you hear me?
Yeah, go ahead.
Yeah. Okay, I've been trying to ask, forgive me, I'm kind of new. This is a new phone, so I'm having situations with it, you know, chatting and everything like that. But what I wanted to know, I hear what you're saying. And we know that the root problem is capitalism, right? Because capitalism oppresses people. So I wanted to know, is the PPC is forming any type of committee or anything like that to change the way we do business, to change the way we get money? Just like you said, we got 1.3 billion and we can't do what we want to do with it. Okay, what's the purpose of having it if we can't do what we really want to do with it? So I want to know on the side, because that committee will have to be separate from any, and really do their homework to see what kind of form of business that we could do to eliminate capitalism, which oppresses. That's why people are poor. That's why a lot of people are poor. That's one of the systemic problems in the system besides racism. So that's my question.
Thank you, Reverend Elizabeth. That's well said. Yuling, you want to respond to some of those thoughts?
I can respond specifically, like, so for the New York Health Act, for example, we eliminate the profiteers who are the, you know, capitalists in our healthcare industry, which in my mind helps decrease the power of also the real estate folks who are in bed with pharma and health insurance, right? And Rebecca maybe can speak more to if there's something specific that eliminates the profiteers in the housing agenda. But yeah, the New York Health Act, it just straight up eliminates the profiteers from the situation.
Yeah, I would say in the Housing Justice for All Coalition, we 100% are working towards completely decommodified housing to eliminate capitalism. And to get to your question of a group that's working towards that, right? I think I can just speak from my experience, right? From my work in the Poor People's Campaign, both at the state level and the national level, I think everything we work towards, even if we don't say we're ending capitalism, right? The solutions that we talk about are centered around that, right? Are centered around solutions that are based in a government that works for the many, not the few, and that deprioritizes profits and reprioritizes people and humanity. So I think there's a ton of working groups in the Poor People's Campaign that you could get involved in. I know there are, I can speak for Housing Justice for All. There's a weekly Friday call, Reverend, that we do with Housing Justice for All, where we brainstorm solutions for housing that I'm happy to share the calendar invite for. That's not PPC, but is specific to housing. So those, just in terms of your question about working groups and being a part of brainstorming solutions, those are two things that I could share.
Could I just say one thing? So in essence, what we are doing, we keep putting a Band-Aid and bleeding fusely. We keep bleeding by putting Band-Aids on it instead of trying to find a way so we can stop bleeding. That's all I'm saying. You know, I know you say you're doing it in housing, but that's just one section, you know, because housing is going to keep bleeding too if we don't fix the whole tree. If we don't fix the root at whole. So just to, I mean, it might take a few years to come up with some solution, but at least as a people, we can. And I heard of other people have been doing this. So I heard of some groups doing that already. So that's why I'm saying, like, yeah, we just, you know, keep beating the bush and that, you know, yeah, we get a little bit here, then we fall back, get a little bit there, then we fall, you know, so why keep cutting yourself when we could try to stop the bleeding?
Yeah,
that's all, sister.
Thank you, Reverend Olivia. And I think that is making me think back to some of the things that have come up throughout today, right? That we can't afford to ask for compromise or gradualism, which is so often the pushback that we receive in movements like the Poor People's Campaign and the Campaign for New York Health and HJ4A that put out demands that are grounded in the actual needs of the people, not an assessment of the political reality that just assumes that we can't have what we need. And I think, you know, Becca in the chat brought up a good point about, you know, using the language of capitalism and anti-capitalism. And I think in different contexts, you know, different ways of talking about things make sense. And I'm reminded of what we heard from Rabbi Michael before about sort of being able to connect with certain people around the language of faith traditions or scriptures. And I think one of the things that the Poor People's Campaign has tried to lift up is a grounding in sometimes faith traditions, sometimes a constitutional tradition, ideas about democracy, and that there are concepts that can reach different people in different ways. But I think what we're holding on to in common is this idea of rights, that which is fundamentally opposed to a system that says you can have housing if you can pay for it, you can have healthcare if you can pay for it, and that should be decided by a market. When we talk about people have a right to live, one of the foundational kind of slogans of the campaign, that's pushing back against this whole idea that things have to be commodified. And so I think, you know, there are different spaces to talk about things in different ways, but it comes back to this moral narrative again, that what we have to push against is not just these different policy ideas, but against the very idea and this question of whether people have a right to live or not. And we have to plant ourselves firmly on the ground that people have a right to live. And that means all these other policy decisions have to follow from that. So we have a few more minutes before we're gonna take a short break, and we're gonna come back and talk a little bit more specifically about next steps. But I wonder, Rebecca, if you could speak just briefly about a little more about this idea of social housing, which is a concept I think not everybody is familiar with, and then Yuling as well. I think you started to get at it, but the kind of what is this non-commodified housing in healthcare actually look like?
Yeah, I'd be happy to, right? And so it takes so many forms. Public housing is social housing, let me name that. And public housing is an extremely important thing that this country should be investing in. And the reason it's portrayed as a failure in this country is because we've disinvested in it, right? And when it was initially invested in, it was intentionally built in segments of neighborhoods that were environmentally harmful, and set up for failure, right? And then we built it and we walked away. And so if you look at countries like the Netherlands, and a host of other countries, their social housing is enormously successful, because they did it the right way. So public housing is social housing. Other forms of social housing are residential cooperatives or tenant opportunity to purchase. So what that means is, instead of us as our governments saying, okay, developers, here we're going to give you tax breaks, tax incentives to build developments that you're going to profit off of, right? We're going to take government money and invest it in community ownership. So if you take a tenant opportunity to purchase, what that looks like is saying, okay, a building's going up for sale that tenants live in, and they get the first right of purchase. And so we know that people who are tenants in buildings often don't have the down payment or the credit, right? Because of the capitalist system working against them, to ever be able to buy their building. And so it's saying the government's going to invest there instead of in private developers. And so they get a extremely low interest loan without a down payment, so that it's almost like a rent to own situation that we read about sometimes with home ownership, right? So that they can buy the building with government backing of the mortgage, and their rent is essentially their mortgage payment. Usually a nonprofit cooperative, right? A nonprofit housing cooperative is the intermediary who helps them basically run the financial components. So helps them handle who has what equity, right? Who's going to make sure that the taxes get paid? Who's going to make sure that the insurance gets paid, et cetera, right? So almost like a management, a nonprofit runs as almost like a management intermediary. When those are done well, those are enormously successful. We have residential cooperatives, which is kind of the same thing, except it's not left up to it being that there's a first right of purchase, but it's basically people getting together, and it doesn't have to be specific to a building, but almost taking like a broader scope and saying, okay, we as residents are going to buy this multi-block area, right? We're going to own this multi-block area. Think of it almost as, you know, how we have these co-ops that work, whether you're talking about farming, right? Or whether you're talking about co-ops that work through when you go to markets, right? There's like a shared ownership in where you live. And again, there's usually a nonprofit housing developer, and I hate to use the word developer because it's so, but a nonprofit housing authority that helps run it. And look at Co-op City, right? It's enormously it's enormously successful. These things are enormously successful, and they need government investment in them. And so why are we not saying, government, you should invest in these types of programs instead of throwing billions and billions and billions and billions of dollars at private developers who we know, right? We've tried that solution for decades. We have all the evidence we need that it doesn't work. We have all the evidence we need that it doesn't work. The housing crisis has skyrocketed since we've tried that approach, right? I mean, how many times do you have to hit your head into a brick wall before you realize that it's going to give you a concussion? It's, you know, we don't need more data to tell us that that's not working, and we need to try something different.
So Rebecca's talking, a lot of what you spoke about is giving decision-making, right, power to the people who are using the housing, right? And so this is also, the New York Health Act is, right now our decisions about our health are made between insurance bureaucrats and legislators, right? Big pharma CEOs. My doctor, my nurse, my caregiver, they want to get me a prescription for something, but they have to go through the insurance bureaucrats who know nothing about my condition or care about my condition. They just care about how much money can they make off of it. So it's giving decision-making back to the people, and also a redistribution of wealth. So in terms of healthcare, right, 30% of the money that I pay to my monthly health insurance premium, for example, doesn't go to care. 30% of that premium goes to CEO millionaire salaries, billionaire salaries, goes to marketing costs, and goes to the administrative bloat of having such a fragmented system that we need so many administrators to help people navigate it. For me, and then for people to have to decide, like, can I take that 10-cent raise, or like I'll get kicked off of Medicaid if I do, and I can't afford the ACA, just with a 10-cent raise, things like that. So removing, decommodifying by redistributing the wealth and removing cost barriers to getting healthcare or to getting housing. And I guess in terms of like examples, the US, for example, spends twice as much on healthcare than every other industrialized country. And every other industrialized country has a form of single payer healthcare. And it's not because we go to the hospital more, or that we see the doctor more, or that we are more sick necessarily. It's also, and even though we spend so much money, we are dying younger. More of our babies are dying than any other country. More of our mothers are dying than any other country. And maternal mortality is like a hallmark marker of how good your health system is doing. And the US is doing really bad. So every other country is able to spend half the amount of money that we do, but cover everyone and comprehensively, and have way better health outcomes. So just, yeah, that's the redistribution there.
Well, thank you so much, Yuling and Rebecca. It has been really fantastic to hear from you both, and thanks for the questions from everyone. We are going to take a 10-minute break, and then we're going to come back and talk about some next steps, and then also close again with some grounding and ritual. Yeah, I think we'll just put a screen up and some music on, and folks can stay on. But thank you, Yuling and Rebecca.
And welcome back. My name is Jonathan. I use the pronouns he, him. I'm a member lay leader at Congregation Beth Elohim in Brooklyn. And we want to appreciate just the fact that we're coming together as members of faith communities, and why that's so important. Let's return to where we began with Reverend Andrew's call to use our stories and symbols, and recognize, as Reverend Theo Harris said, that what has come to be accepted as theology today goes completely against our sacred texts. And what Sanjay Sherry said, that we can use sacred texts to remove the veils of ignorance. And from my breakout group, that leaders in faith communities have power. With all that, we want to be clear that faith communities have a critical role confronting the false moral narratives that misuse and abuse our religious traditions. Religious communities, faith communities have an important role in educating, organizing, and mobilizing our communities to end systemic racism and the interfunctioning evils of poverty, racism, militarism, and environmental degradation. So with that, what we want to do is we want to point out things that you can do as individuals and as members of faith communities. Okay, great. So we want to go through a couple of next steps that people can take and really invite people to think about what's right for them. We're going to end with a poll just to ask you to think about what commitments you can make as we move forward. But in terms of next steps, there are things that you can do. You can join our monthly faith group organizing meetings. Our next meeting is March 11th, and there's you can RSVP at the bit.ly that's here. We also encourage you to help educate folks within your own faith community and to help shift the moral narrative, help members of your community understand this work and use faith to orient people to this work. We as members of the faith group organizing committee are really very happy to work with you on this, to help you access the resources that we've been collecting at the state and at the national level. And we encourage you to reach out to us at New York at poorpeoplescampaign.org and let us know what would be useful to you. If that means that that we have a one-on-one conversation and review some resources and help you think about how you can use these resources, that's great. If it means inviting someone from the faith group organizing committee or from one of from the larger Poor People's Campaign community, we're really happy to co-facilitate meetings with you and folks in your community. And we can think about this as a one-off or help you sort of plan longer term to do the education and organizing and mobilizing work within your faith community. We also encourage you to participate in national faith events. We mentioned earlier in the day the Freedom Church of the Poor that convenes every Sunday at 6 p.m. There's also the service in Spanish at 7:30 p.m. For both of those, you can find your way to the facebook.com Poverty Initiative site, and those are streamed there. Also at the national level, there's the National Prophetic Council. It's a regular meeting of faith leaders, and if you're interested in becoming part of that conversation, that community, you can email Kelly at thepoorpeoplescampaign.org. The National Prophetic Council helps to organize the Moral Mondays and the Truthful Thursdays, and we really encourage everyone to look at those efforts that are national. And then within New York State, we are organized from the state into regional organizations, Long Island, New York City, Hudson Valley, so on and so forth, each being their own regional committees. And so if you would like to join your regional committee, you can email newyork@poorpeoplescampaign.org, and we'll help connect you with the folks who are organizing not only at the state level, but more regionally. And we'll take an extra couple of moments just to talk a little bit more about this campaign to fund excluded workers. And Joe, I'll let you take it from here.
Sure, I'll be real brief on this. You may have received an email from either the Labor Religion Coalition or Poor People's Campaign around this. The Fund Excluded Workers campaign, oh, here's a whole bunch of details in this slide. Yeah, so the short of it is some people fall through, for various reasons, have fallen through the cracks of whatever pandemic relief has been on offer over the past year. Typically, this is based on immigration status, but sometimes, depending on the kind of job people have, they may have been excluded from eligibility. But we also know the Department of Labor has had a really difficult time keeping up with all of the need and just reaching folks in that way. So even many people who might be eligible for that are either being denied unfairly and have entered into like longer term processes to try and sort that out, or people just gave up even trying, might not have been eligible. So there is a campaign primarily led by immigrant organizations, but actually a whole lot of groups. I'll share the website link shortly. Actually, you can find it there in that short link right here, are calling for an excluded workers bailout fund. Simple idea. Take the money from rich people, tax billionaires. It's part of the Invest in Our New York campaign, and then provide a fund to relief for pandemic relief for all workers, but focus particularly this fund to be able to reach those who've been unfairly and unjustly excluded. So what we're doing, our contribution to this campaign is a faith leader sign-on letter. I'm guessing nearly every single person on this call considers themselves a faith leader. I put a link in the chat here. I'll do it one more time, but you can go to that link, take a look at the letter itself that goes to the governor and the legislature, and add your name. If you have any questions, you can contact me directly around it. And I urge you to do that as soon as possible. We are hoping to release this letter by the end of this week. That's it for me.
Great. And we really, we recognize that there's a wide range of ways for faith leaders to get involved. We'd really encourage you to think about what's right for you. And we'd also like to support you in the commitment that you're making. And so we just put up on Zoom a poll with questions about ways that you'd like to get involved. Join the monthly faith group organizing meetings, educating within your faith community, worship with the Freedom Church of the Poor, join the National Prophetic Council, join a regional committee, endorse the campaign to fund excluded workers. Really, we encourage you to take a moment to think about what feels right for you. What next steps can you take? What commitment can you make for yourself to support the Poor People's Campaign, to engage your faith community? I know that some people are seeing the poll and people are starting to respond. That's wonderful. If you're already doing all of these things, that's wonderful too. We are happy to see how people want to be engaged, and we also want to support people in their engagement. So we'll just get wonderful. And so for our closing worship, I'm going to turn it over to Lakeisha Williams.
Thank you, Jonathan. Can you all hear me all right? Okay, we're trying something different with this today. So if you can't hear me, just give me an indication. As Jonathan said, I am Lakeisha Williams. I am with the New York City Regional Committee of the Poor People's Campaign, as well as the State Coordinating Committee and the Faith Committee. And I have been tasked with trying to bring all this stuff to a close. So as the sacred text to guide me today, I'd like to take a look at the lyrics from Sweet Honey in the Rocks, I Remember, I Believe. And the lyrics say this: I don't know how my mother walked her trouble down. I don't know how my father stood his ground. I don't know how my people survived slavery. I do remember, that's why I believe. I don't know why the rivers overflow their banks. I don't know why the snow falls and covers the ground. I don't know why the hurricane sweeps through the land every now and then. Standing in a rainstorm, I believe. I don't know why the angels woke me up this morning. I don't know why the blood still runs through my veins. I don't know how I rate to run another day. I'm still here running, I believe. My God calls me in the morning dew. The power of the universe knows my name. Gave me a song to sing and sent me on my way. I raise my voice for justice, I believe. You know, there are a couple of instances in scripture where in the same breath, somebody says to Jesus, Lord, I believe, help my unbelief, which on the surface to me feels a little oxymoronic and confusing, but also is so reflective of many of us in how we wrestle with faith and tradition and everyday existence. I believe, help my unbelief. It's paradoxical phrasing and also deeply thought-provoking, right? And certainly embodied in struggle and in movement. How can we say that we believe and at the same time ask for help in overcoming unbelief? I think that in a multi-layered pandemic-filled world where so many of us are searching for something to believe in, I dare to say that unbelief is the place where we unplug from the matrix, where we unplug from the narrative that has been written by the ruling class and funders and philanthropy and those who want idealists and service providers and those of us who remain hopeful to find satisfaction with the myth of scarcity and even in small wins, where capitalistic values and mammon and individualistic ideals have crept into our sacred spaces and corrupted our priests and our prophets, where suffering and shame are branded on those of us who are unbought and unbossed. Unbelief for me is the place where liberation becomes tangible. When the world around us causes us to weep, I'm a weeper. I am an absolute weeper. When the world around us causes us to weep and even in some cases wail or cry to the point where we can't even get any words or sounds out, when we're weary and wavering in our resolve, on the days where sometimes like me, our bodies and our minds are just unwilling. And even on the days when we feel personally inept, help our unbelief. Remember, believe through it all and in the face of suffering and hope against hope, in the face of unconscionable evil and corruption, those things that sometimes just won't quit. Don't you quit. Remember, believe. As we've gathered here today, know that it is our responsibility to teach the liberative faith traditions that are the breath of this work. It's our responsibility to, as Aurelis said, learn as we lead, walk as we talk, and teach as we fight. And so, as we close, I want to challenge and charge you to remember and believe no matter what. Remember and believe no matter what. Remember and believe no matter what. Help our unbelief, but believe in this movement. Believe that you can unplug from the matrix of that other stuff. Believe in change. Believe that everybody has a right to live. Believe that ending poverty is possible. Believe that systemic racism has no place here. Believe that we can turn weapons of mass destruction or even weapons of mass distraction into plowshares and study war no more, even the war that comes against our minds. Believe that we are the transformative instruments of redemption that we have been waiting for. Believe that we're inextricably connected to every single one of each other. Believe that guaranteed healthcare, housing, food, education, and adequate incomes are all human rights. Believe in what Dr. King called the beloved community. Believe that when you lift from the bottom, everybody rises. Believe that the sacred fire that emboldens us will see us all the way through, y'all. Believe that even in our moments of weakness, there's a spark of sacred fire that can never be extinguished. Even when we personally feel exhausted, it's the spark that can never be extinguished. And that's what compels us to keep on keeping on, in the words of my foremothers and fathers. Believe that that spark continues to ignite a radical revolutionary love that changes us. And because it changes us, Jonathan, that changes everything. Believe that in the end, love wins. I don't know why, don't know how, but I believe in a deep and abiding commitment to this moral movement where the interconnectedness of faith, belief, and unbelief are expansive, inclusive models for what the future can look like. Don't stop believing, y'all. Our children and our children's children are watching, and they're reading the narrative that we are all writing together. My God calls me in the morning dew. The power of the universe knows my name, gave me a song to sing and sent me on my way. I raise my voice for justice. I believe. Remember, lift as you climb. Remember and resist. Be brave. Raise your voice for justice. Believe.
I don't know how my mother walked her trouble down. I don't know how my father stood his ground. I don't know how my people survived slavery. I do remember, that's why I believe. I don't know why the rivers overflow their banks. I don't know why the snow falls and covers the ground. I don't know why the hurricane sweeps through the land every now and then. Standing in a rainstorm, I believe. I don't know why the angels woke me up this morning soon. I don't know why the blood still runs through my veins. I don't know how I rate to run another day. I am here still running, I believe. Hit him a little, hit him my God calls to me in the morning dew. gave me a song to sing and sent me on my way. I raise my voice for justice, I believe. Hit 'em, my lady, hit 'em, hit 'em, my lady, hit 'em, hit 'em, my lady, hit 'em, hit 'em, hit 'em, my lady, hit 'em, my lady, hit 'em,
Look out for an email that will be coming to y'all soon with a lot of the things that we mentioned. We hope to see you next month, really in just a few weeks on March 11th for our next faith gathering as a state PPC. And we look forward to continuing this joyful and beautiful struggle together. And in the words of our movement, forward together.
Not one step
Not
back.
one step back.
One step back.
Together.
Not one step back.
One step
Not one-
back.
Go in peace, y'all. We'll see you soon.